welcome to the new episode of Dil Ke Doubts. Dil Ke Doubts is one of the key initiatives of the Heart Health India Foundation, where we engage with experts to discuss important topics related to cardiovascular health. Heart Health India Foundation is a patient-led patient support group, which is one of its first kind in India. On today's new Dil Ke Doubts episode, we are joined by Ms. Kusha Jhunjhunwala. Ms. Kusha is a dietitian and a health coach. She has a master's degree in nutrition and dietetics from Galgottias University, Greater Noida, and has worked at various hospitals, including Fortis and SRMS. She is the founder of Health 2.0, where she helps her patients reach their health and wealth goals through their diets. Her area of focus is heart health, and she is associated with some NGOs with the same task. She gives her patients simple homemade food diets without any frills so they can follow it without hurting their pockets. She believes that a healthy diet can work wonders on your heart if it is also paired with a healthy lifestyle, and coaches her patients on how to make those changes. With Health 2.0, her motto is to help you become the better version of yourself. Our discussion today with Ms. Kusha will focus on diets to reduce cholesterol. LDL cholesterol, or low density lipoprotein cholesterol, is often referred to as bad cholesterol because it can contribute to the buildup of plaque in your arteries. Having high LDL cholesterol levels is a major risk factor for heart disease and stroke. The higher your level of LDL-C, the greater your risk. The good news is that you can take steps to lower your LDL-C. Thank you, Ms. Kusha, for joining us today. And let's start the discussion. Thank you. Let's start the discussion by explaining to our audience what cholesterol is and why it's important to manage its level in our body.
Thank you, Tanushree, for your great introduction. I'm really happy to be here. So first of all, as you know, my focus is on heart health. Okay, and while working in hospital, I saw many different patients with different diseases and different age factors, and also I have given them different guidelines accordingly. So I realized that many of the diseases like hypertension, diabetes, and issues related with kidney and liver are actually related to your heart. So if you have a healthier heart, you have a healthier body. And most people come to me, they are beginners, which have just started their health journey. They have already learned about trendy diets, but my motto is to encourage them to go for simplest homemade diet, and budget friendly diet, and which is available for all. So there are some key aspects of heart. We will talk about some key aspects for heart, like diet and nutrition. It is the first and the foremost aspect of healthy heart. And then we will have physical activity. We should exercise at least for half an hour to keep the heart muscle strength, and to keep blood circulation. And cholesterol management is the third and the foremost important aspect of heart health. Actually, what is cholesterol? Cholesterol is a fatty substance which can build up in arteries, and it is the reason to narrow and hardening of the arteries. Weight management is obviously done with the good diet and exercise. And stress management, it is the last and important aspect of healthy heart. Now we will move on to what is cholesterol. Cholesterol is a fatty substance in the body which is essential to many metabolic processes. Cholesterol is produced by liver and also made by most cells in the body. These are of two types, LDL and HDL. Low density lipoprotein carries most of the cholesterol that is delivered to cells. It is also called as bad cholesterol. And HDL is high density lipoprotein. It is called the good cholesterol because it helps to remove excess of bad cholesterol out of the cells.
Thank you for the explanation. So could you tell a little bit more about these cholesterols and how it relates to food? So what I mean to ask is, when you go shopping or you go outside to eat food, a lot of
Mhm.
news these days tells you, oh, you should not eat this type of fat. It can lead to high cholesterol, or you should eat these types of fats. So there are many words, right? There's trans fats and there is saturated fats. So can you tell us what are the differences between these types and what kind we should eat?
Okay. So we have two types of fat, which is trans fat and saturated fat. Trans fat is directly related to our heart health because it actually damages our heart. And saturated fat is also not good, but it is also related to heart health also. So we can say that it trans fat raises the levels and drop HDL levels. मतलब वो जो है LDL को बढ़ाता है और HDL को घटाता है. Then we have in saturated fat we have raises LDL and HDL in blood. It raises the both LDL and HDL. It is trans fat is directly associated with cardiovascular disease, and saturated fat is also reduces the cardiovascular disease. So it is solid at room temperature, and saturated fat is semi-solid at room temperature. Trans fat raises the levels of C-reactive protein. C-reactive protein is a protein which is made by liver, and saturated fat doesn't raise the level of C-reactive protein. Sources of trans fat are hydrogenated vegetable oil, fast food, cakes and pastry, uh, chocolate, deep fried foods. And sources of saturated fats are coconut oil, palm oil, fatty meat, butter, ghee. So these are the sources of saturated fats and trans fat.
Thank you for sharing. So nowadays, a lot of younger people are struggling with heart health. Every day you open the news app and you see like someone 20-year-old or 30-year-old has died from a
Yes.
heart attack or has experienced some heart disease. So because cholesterol is directly related to heart health, can you tell like what are recommended cholesterol ranges for HDL and LDL and for
Mhm.
the younger generation, 25 to say 35-year-old Indians?
Okay, so the general total cholesterol level is 200 mg per day. And we believe that HDL is above 60. HDL should be above 60 and LDL should be above 100, below 100. So your total should be below 200. And for adult, it is recommended that 125 to 200 mg you can have cholesterol range.
Okay. And ये tests हमें कितने frequency में करने चाहिए? Like if once we turn say 20, 25, how frequently should we
Hmm.
get our cholesterol tested?
If you see those signs and symptoms, you can have those tests accordingly.
Okay. But would you say like once a year is a decent level of testing or,
Yes, once a
regular?
year.
Okay, okay, once a year. Thank you. Um, so you said when you see the signs and symptoms, it will be a good idea to go for more checkups. So what are the warning signs for high cholesterol? Without testing that you can notice that these are warning.
सबसे पहले तो it comes excessive weight and the body fat. If your weight is increasing, it is a sign that you can have a risk of heart disease. Then we have a warning sign called nausea, numbness, slurred speech, extreme fatigue, shortness of breath, and high blood pressure. High blood pressure, which is dystolic and systolic, so it is 120 by 80. अगर उससे ज़्यादा आता है, तो then it is a sign of it is a risk of heart disease. So you should always maintain your blood pressure.
Okay, okay. Thank you. So, once you are categorized as a heart disease patient, there's a lot of medications that you are, given to take. One of them are statins. So, can you explain what statins are? And then,
Mhm.
is it advisable for patients to discontinue taking statins after some time, or what is the process? Can you tell?
Okay, statins are the group of medications which help in lower your cholesterol, lower your LDL basically. So statins जो हैं वो आपके प्रोडक्ट LDL के प्रोडक्शन को रिड्यूस करते हैं एंड डॉक्टर ने प्रिस्क्राइब अगर आपको हार्ट अटैक या स्ट्रोक आता है तब, पर तब भी आप ले सकते हैं अगर आपके नॉर्मल रेंजेस हैं, क्योंकि अगर आप उसे कंटिन्यू करना चाहें तो वो भी आप कर सकते हैं. There's no
Okay.
harm in continuing statins
Yeah,
if you have
but
normal range.
many patients after some, like, they say they had a heart surgery or something, then for the first few months they are very good with medication adherence. They will regularly take their medicine, but after some time they think कि अच्छा अब तो मेरे को लग रहा है कि मैं ठीक हूँ, so then they stop taking their medicines. So is it advisable कि if you stop taking statins, then what happens to the body? Can you tell us that?
You can stop taking statins if you are normal. If you have a normal range, there is no harm to stop statins.
Okay, so is that something the patient can judge by themselves कि अब मेरा normal level है, या फिर they should visit the doctor and doctor should only be the one to advise कि now you can stop taking?
Yes, actually, they should visit a doctor, and doctor will always be a good advisor for medications. So he can only tell कि it should be stopped or it should be continued.
Okay, yeah. And what happens if people have high cholesterol levels, but they decide कि नहीं, it's okay, it will be fixed by itself. Yeah, they don't go for treatment. So what happens then to the body?
Okay, so this is a very good question actually. And if cholesterol is left untreated, then your levels of high LDL in your body, which is bad cholesterol, can build up a plaque. तो वो plaque बन जाता है. Then in your body, in your arteries, और वो plaque जो है eventually grow करता है, जो कि and make it difficult for enough blood flow to through the arteries. ठीक है? तो वो जो है ब्लड फ्लो में डिफिकल्ट कर देता है. देन हाई कोलेस्ट्रॉल जो है वो फैटी डिपॉजिट भी कॉज करता है टू डेवलप इन योर ब्लड वेसल्स.
Okay, thank you. So your main task, you mentioned that you run the Health 2.0. You're helping patients with planning their diets and so on. So, everyone day one, they think, okay, from now on, I'm going to reduce my cholesterol. From now on, I will reduce my weight. But actually, to do it long term is very difficult for patients by themselves. So can you, from your level of expertise, share some ideas of low cholesterol meal options? Everyone's diet is different. North Indian, they have a different diet, South and so on.
Yes.
So can you give some examples? Ki these are low cholesterol meal options that are good on a daily basis.
Okay, so there are some low cholesterol meal options. The first one is oats upma. We can have oatmeal. We can have moong dal chila. We can have poha, vegetable khichdi, palak paneer, which is paneer should be low fat, and roasted chana, fruit chaat, sprouted salad. And in drinks, we can have masala chaj, amla juice, and herbal tea.
Okay.
So these are some options to low cholesterol.
Okay. So basically, these are food that have low cholesterol, not that they help in reducing cholesterol, right?
No, they also help in reducing cholesterol.
Okay. And so, a lot of people nowadays are have really difficult or stressful daily jobs. They don't have time ki ghar pe they can cook all of these meals. So a lot of people go outside to eat. And can you recommend how they can still manage a low cholesterol diet even though they are going outside to eat sometimes, or they have a stressful daily job?
Okay, so I have designed a meal plan for them. Can I
Okay.
explain it?
Yeah,
Okay,
please
so
go for it.
first of all, in the early morning from 6 to 7 a.m., you can have a lemon water or green tea with 4 to 5 soaked almonds or one anjeer or with one walnut. Okay. Then in breakfast from 8 to 8:30, you can have vegetable dalia, moong dal chila, besan chila, suji upma or oats chila.
Okay.
And you can have a cup of milk with that, which should be 200 ml of skim milk.
Skim milk. Okay.
मिड मील में आप ले सकते हैं सीजनल फ्रूट लाइक एप्पल, नाशपाती, अंगूर, पपाया. In lunch, you can have chapati 2 to 3. In chapati, you can add a millet one in the 1:1 ratio. Like you can have a jawar in the 1:1 ratio, and you can have the wheat in the 1:1 ratio. And you can mix it up. And you can have chawal. तो उसका starch निकाल के आप खा सकते हैं. You can have green leafy vegetables like tori, lauki, parmal, tinda. Then you can have dahi, one small bowl. In evening 5 to 6, you can have tea or coffee. Use skim milk. Then if you are diabetic, you shouldn't eat any sugar because any sugar like jaggery, honey or sugar, it is very harmful for diabetic patient. And for non-diabetic, you can have jaggery. Half teaspoon jaggery is allowed. Then in dinner, you can have palak paneer, mixed veg, bhindi, dal, one small bowl, chapati 2 to 3 with flour with bran. मतलब जो fiber होता है ना wheat का, उसके साथ आप ले सकते हैं आटा.
Okay.
So this is a small sample menu plan which I have designed for the people who go for office and don't have time to cook.
Okay, thank you. And so this meal plan sounds very North Indian. So can you give us some options of South Indian cuisine based, like what are some low cholesterol food options?
Okay. So in South Indian, you can have oats idli with coconut chutney. Then the next one is you can have a whole grain upma. Then you can have a one bowl of sambar with rava onion dosa.
Okay, thank you for sharing. So I want to keep talking about this idea. Nowadays people are constantly going outside to eat because it is more convenient. You don't have to spend lots of time cooking, and food is relatively affordable outside. So a lot of the food that we eat outside, it's called as processed food or ultra processed food. So how does processed food impact this cholesterol level, specifically the bad cholesterol level? And what should people look out for? They go to the grocery store and they're buying processed food like cheese or something. What should they read in the food labels and then decide, okay, this is healthy enough for me to buy as someone on a low cholesterol diet?
Okay, so Tanushri, you are absolutely right. हमारी जो preference होती है वो junk food की होती है, right? So junk food is the easiest way to lean on, and it is the easiest way to have it anytime. So it is really right. My focus is on plant-based diet, which comes from nature and which comes from vegetable, fresh fruits, green leafy vegetable, fresh fruits, whole grains, milk and milk products. So like this is free from any added preservative, and it is also free from any adulteration. It is budget friendly also, and it is available for everyone. People have to understand what is a balanced diet. Balanced diet is actually we can have all vegetables, all whole grains, and all milk and milk products in our plate. So we should actually go for that instead of junk food. And in market, you can notice in the label like sodium levels, sodium, cholesterol, how much cholesterol is present in the that particular packet, and how much sodium is present in that particular and how much is the trans fat and how much is the saturated fat. So these are some terms which we can have to look on the packets of labels of packets.
Okay, thank you. So, from your clients or patients that you see, what are some of the high cholesterol foods that you notice a lot of people with the Indian diet, try to buy, but
Mhm.
they should avoid or minimize those high cholesterol foods?
Okay, so there are some high cholesterol foods like fried chicken, French fries, pakoras, and samosas, which really people go for. Then we have red meat to avoid. Beef and lamb are the some options to avoid in high cholesterol levels. Then we have full fat dairy products. Instead of full fat, whole food fat food, you can have skim milk also, and full fat cheeses, butter, ghee are the some high cholesterol options.
Okay, thank you.
Then we have
Maybe,
baked goods.
go ahead, sorry.
Are you saying something?
Yeah, and I was saying go ahead. I accidentally interrupted you, but go ahead and
Okay. No issue, no issue. So we have baked goods like pastries, cakes, cookies, donuts. मतलब ये बच्चों को बहुत पसंद होता है कि डोनट खाएंगे आज या पेस्ट्री खाएंगे. So बच्चों के लिए स्पेशली हमें अवॉइड करना चाहिए ये सब चीजें. Then we have oil like palm oil and coconut oil. These are the low grade oils which we use in our मतलब नमकीन हो गया या फिर जो भी मार्केटेड फूड हो गए उसमें भी यूज palm oil or coconut oil. Then we have fast food like burger, pizza, and fried foods. So these comes in high cholesterol option.
so from what I know, the palm oil, like for example, you have mentioned, this oil is actually used in lots of, chips that we buy or different types
Yes,
of snacks that are available in the market. And
yes,
they're actually quite cheap, and kids jab bhi school se aaye, they'll buy it or something. It's very convenient to get these snacks that have palm oil or something. So what are some
yes. It is
healthy alternatives we can persuade our kids or some, our family members ki nahi, don't buy this one, this has palm oil, instead ye wala kharido, this is better. So what are some alternatives?
okay. So instead of palm oil, we should always use olive oil. Olive oil is the healthier option, and we can have snacks which contain olive oil in them. So olive oil हो गया, groundnut oil हो गया. These oils are really very healthy. Mustard oil हो गया, कच्ची घनी का तेल जो हम लोग यूज करते हैं खाने में, तो वो वाला ऑयल हो गया. तो ऑल्टरनेटिव्स ये हैं जैसे मैंने पहले भी बताया कि होल फैट मिल्क की जगह वी कैन यूज लो फैट और फ्री फैट मिल्क. एंड एग योग होता है तो उसका येलो पार्ट निकाल के ओनली यू कैन हैव द एग वाइट.
Okay.
Then you can have instead of fried foods, you can have baked, grilled, or air fried foods, which is more healthier. Then you can have homemade baked goods, जो कि बने होते हैं होल ग्रेन से. मतलब जो कि आपके होल ग्रेन से बने होते हैं, सपोज फ्रॉम लेंटिन और जो भी दालों से बने होते हैं या रागी मिलेट से बने होते हैं, रागी और जवार जिनका बेस मिलेट से बना हुआ होता है. वी शुड ऑलवेज चूज दोज food instead of marketed based products.
Okay. Okay. Thank you. So one question I have, you mentioned just few minutes ago that people should try to avoid things like fried chicken or red meat like beef or lamb, but nowadays the younger population is very into going to the gym or bodybuilding, and they think that
Yes.
they need to have these sources of non-veg so they can have enough protein in their diet. So as you have earlier mentioned that you promote this sort of plant-based diet, and I'm also a vegetarian actually, and this is a question that I am always wondering, ki how can I have enough protein in my diet while still, being a vegetarian? So do you have any tips how we can avoid the cholesterol but still have enough protein?
Okay, so in vegetarians, we have protein sources in lentil, in Bengal gram dal, in black gram dal. So these are some options from which you can have the protein from dal. So if you have dal roti, you can also borrow some protein from it. Okay, then we have the next option, which is paneer, and the second option is tofu. So tofu has more protein than paneer. You can switch to tofu if you want more protein. Then it comes soya bean. So soya bean or soya badi, it has more protein than any other vegetable. So it's the best option. You can have soy chunks. You can have soy milk instead of whole milk or skim milk. If you want another option, you can have soy milk. Then we have another option like green leafy vegetables. So green leafy vegetables are the good option. We can have protein from fruits also. So you can also switch to fruits like apple हो गया या apple papaya हो गया. So उसमें protein इतना नहीं होता है but protein होता है काफी हद तक. So we can have fruits in a diet. We can have green leafy vegetable in a diet. We can have soy paneer in a diet to include protein in a diet. So these are some options which we can have in our diet to include protein.
Okay, thank you. Thank you so much for sharing. So do you have any advice for people, who are just starting their journey into, making those behavior and diet changes towards lower cholesterol or, just healthier diet in general? Ki how should they start that process? Ki actually sustainably they can make their goal of reducing cholesterol, because there are many how to say diets that are very extreme that you can find online, and it is not actually easy to complete those targets that you find online. So what are some suggestions or advice from your side ki this is how you should start your diet process?
Okay, so those people who have just started their health journey, I would like to suggest them to include green leafy vegetable in their diet, like permal tenda toru, hindi, or there are many options like paneer ki sabzi you can have in your diet. Then you can have fruits in your diet. You can have mixed fruit chaat in your diet. You can have masala charge drinks in your diet, masala charge, amla water, and nimbu pani green tea. You can have these drinks in your diet. Then you have to just switch to what you eat. So it will take little time, but if you switch to what you eat, it will be more beneficial for you. Like if you are eating normal roti and sabzi with no green leafy vegetable, so you can just add one green leafy vegetable, and you can it can be a go-to meal for your healthy heart.
Okay.
And you can also add oats in your diet. You can have a lot of fiber in your diet, which is good for your heart. You can have a lot of antioxidant in your diet. Antioxidant कहाँ से आता है? Berries से आता है, like blueberries, strawberries. इन सब से antioxidant मिलता है. Cranberries से हमें antioxidant मिलता है. So these are some options for antioxidant. High fiber diet में you can have oats, you can have vegetables, you can have fruits with pulp. Don't have fruit juice because उसमें सारे nutrients जो हैं वो निकल जाते हैं. When we have a fruit juice, all the nutrients are out from the fruit. But if we have a fruit with pulp, we can have a whole fruit nutrient together.
Okay.
So these are some options from people who can include having.
Yeah. So one part of diet journey is making ye changes into their diet, ki replacing or substituting some alternatives that are healthier. Another part of, I think, diet journey is, motivating oneself ki every day I will actually eat these things. And even though thoda sa it
yes,
will taste healthier, not as tasty as the one is used to, ki, इसमें इतना थोड़ा घी कम है and so on. So it will be a little different, and it will be difficult to motivate oneself ki every day I will have eat this healthier option. So when patients come to you with this complaint कि मजा नहीं आ रहा है diet में, या it is difficult to follow, what advice do you give them that motivates them कि yeah, we can do it?
okay. So if we leave diet aside, so there is a one factor which we should focus on, which is lifestyle. Lifestyle is the main for factor for your heart, healthy heart. Okay. So in lifestyle, you can change your routine. If you are waking up at 12 a.m., you can wake up at 7 a.m. and you can have some healthy drink. Okay. Then routine ho gaya. Then your sleep cycle is the main factor. If your sleep is good, you will produce a hormone called melatonin, and this melatonin will help you in keeping your heart healthy. Okay, so sleep cycle हो गया. Then we have weight management. वेट मैनेजमेंट लाइफस्टाइल का पार्ट इसलिए है क्योंकि वेट मैनेजमेंट बहुत जरूरी होता है, क्योंकि वेट मैनेजमेंट जो है इट इज रिलेटेड टू एवरी डिसीज लाइक डायबिटीज, हाइपरटेंशन, हार्ट डिसीज ऑल्सो, इट इज रिलेटेड टू हार्ट डिसीज ऑल्सो. And then we have our routine lifestyle. We have exercise. So if we include physical activity in our daily lifestyle, so if we do a brisk walking for half an hour, or we are doing yoga for half an hour, 1 hour, it is much healthier for your heart.
Yeah.
So these are some points you can include.
Okay, thank you. So I want to confirm so that you're trying to say keep basically making changes in lifestyle, improving sleep and your daily routine can actually motivate you better to follow through with changes in diet or exercise. Is that what you're saying?
Yes, yes.
Okay, okay. Thank you. And one question final I have is, you have given some suggestions. This is what you can eat to have low cholesterol. Other than that, you also have your Health 2.0 where you provide customized plans,
Yes.
right, for patients. So when should a patient seek professional, customized help versus बस ये suggestions देके they make the changes in their daily life? Like, when do you recommend professional help in this area?
Okay. So in my Health 2.0, people come with me different issues. Some comes with weight management, some come with heart health, some come with diabetes, some come with hypertension. Okay. So I suggest them a professional guidance according to their diseases and according to their important parameters. So वो parameters क्या होंगे? Parameters ये होंगे कि what is their age, weight and height, and what is do they have any medical issue or not, and what are their goals to achieve their weight target. So these questions are asked before giving their diet plan. Then accordingly I make the diet plan for them, and accordingly I make the diet plan for them, and it is like it is actually very customizable according to the patient's need.
Yeah. So, would it be correct to say कि if you are in the stage कि already you have some disease and you are trying to make changes, weight loss या cholesterol management, then you should go for this customized plan to your parameters. But अगर आप अभी preventive stage में हो and you don't have a disease right now, then it is okay कि you take this advice that you have given today and अपने आप
Yes.
से they make changes that is good enough, right?
Yes, yes.
Okay, okay. Thank you.
It's not
And
like that कि कुछ भी खा ले. एक
yeah,
प्रॉपर गाइडेंस तो चाहिए ही होती है आपको एक
yeah,
डाइटिशियन की. So you can also consult a dietitian if you don't want a proper diet plan for yourself, but you can consult a dietitian for a guidance to what to eat or not, what to eat or what to eat, what not to eat.
Okay. Okay. Thank you so much for helping us learn a lot more about, meal planning and foods that are good for low cholesterol or alternatives that you can make to our diet. And, if patients are interested, they can maybe reach you out regarding your Health 2.0 services in the future.
Yeah,
So
sure.
thank you so much for joining us today on Dil Ke Doubts session. We were very honored to have you provide your expertise in the field. I'm sure our patient and caregiver community will find this information very useful. So thank you so much for joining. And patients can
Thank you,
find
Tanushri. Thank you,
Thank you so much.
Tanushri. I'm also privileged to associated with Heart Health India Foundation, and I'm honored to share my dietary tips on heart health today in this seminar. So thank you so much for this opportunity.
Thank you. If patients are interested, they can find more information on our website or our YouTube channel. Our website is hearthealthindia.org. Thank you. Uh,
Okay. Thank
I
you,
will stop.
Tanushri. Thank you.
Thank you. I will stop the recording now.
Okay.